Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rankus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you, everything from nutrition and mental health to alternative therapies and natural living.
We'll bring you the expert interviews, insightful discussions, and practical tips to make motherhood a little easier and help your family thrive.
Please keep in mind that this podcast is for informational and educational purposes only and is not intended to replace the advice, diagnosis, or treatment plans you have with your personal healthcare team. Please have a conversation with your trusted healthcare provider prior to making any changes or implementing any strategies or advice you learn from this podcast.
Whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Here at the Motherhood Alliance podcast, we challenge the status quo, ask the tough questions, and offer a supportive community for moms who want to make an informed, holistic choice.
Thank you for joining us on this journey.
Let's get started. Hi, we are Britt and Andrea from motherhoodalliance.com, and we're excited to welcome you to a 4-episode series with Dr. Veronica Tovar, a Greenville-based dentist who has taken whole body health to an entirely new level. Beyond traditional dental training, Dr. Tovar has trained with some of the top institutes in airway health, myofunctional therapy, oral restrictions, dental sleep medicine, sedation, laser dentistry, you name it, she's probably had some training in it. She's an ambassador with the Breathe Institute and a Breathe Baby affiliate. She's also a Vivos and tooth pillow provider. What really drives her, though, is the belief that the mouth is the gateway to the rest of the body, and the ripple effect she sees when patients finally feel better, breathe better, and realize they didn't have to live feeling the way that they did. As a mom herself, she is especially passionate about helping future generations grow and thrive optimally, and she loves supporting mothers through healthier breastfeeding and airway journeys. Outside of her practice, Veronica's all about family time. She enjoys golfing, working out, reading, and keeping her violin skills alive as well. She and her husband are raising 3 daughters who are currently 7, 9, and 11, along with their 2 pups, Rocky and Raina. All right, you guys, you are going to learn so much from Dr. Tovar. Let's jump in. Hello, welcome back to episode 3 with Dr. Tovar. We are excited to continue this conversation. If you have not listened to episodes 1 and 2, I'm going to ask you to hit pause, go back and start with episode 1, because this really is a great series where it's building upon itself just through the education, the knowledge that she's sharing. But today we're going to be talking about nose breathing, and it's so important. And I feel like a lot of people, the only time they really think about nose breathing is if they're doing yoga and they're like, in through your nose, out through your mouth. And otherwise you just live your life and you do your thing. And
it's just breathing, right?
And it's just breathing.
Why are
so
we
who
talking
cares?
about breathing?
Yeah,
right?
Who cares which inlet it goes through, your mouth or your nose? So we're gonna kind of debunk that and talk a bit about it. All right, let's start high level. Why is nasal breathing so important for overall health?
Oh my goodness, this is fun stuff. Yeah. So I know in one of the previous episodes I mentioned Patrick McKean and his books, Oxygen Advantage, Close Your Mouth. So I learned from Patrick McKean. I did the training this last summer. Okay. And listening to you, hear you say about in through your mouth, or in through your nose, out through your mouth. Well, there's even debunking to that. Okay. So why is it so important to breathe through our nose and not through our mouths? I mean, from early on, the nose, the anatomy, the physiology is to convert this air we're taking in and have that conversion to carbon dioxide and nitric oxide. Carbon dioxide is what is carrying the oxygen to every cell that needs it in the body, okay? Nitric oxide is the body's defense mechanism. It's the body's immune system. It is our anti-inflammatory, antifungal, antiparasitic, antiviral. It is our immune system. We take that away and start mouth breathing, we are eliminating a lot of our body's immune system defense mechanism to work. We're also minimizing the percentage of oxygen that is being delivered arterially. Okay. add to that, which, some would say, geez, you're a dentist. Why are you talking about breathing? Well, because mouth breathing impacts my mouth. The mouths I work on are dry. We're changing the microbiome. We're making it more acidic. Acidity leads to dental decay. And if I want to do more fillings, then go ahead, keep on breathing through your mouth. But it's that imbalance of diaphragmatic breathing versus chest breathing. So it is a smaller passageway which requires more work from the body. To breathe in through the nose, use that diaphragm, not just the chest. Okay. And then to say, okay, breathe out through your mouth. Well, we just expelled all the CO2 we just created. We need that oxygen in the body. We should be breathing in through our nose and be slowly exhaling through our nose. So we have that oxygen delivery to the body. And it's not about the oxygen. It's actually about that conversion to CO2, carbon dioxide, and nitric oxide. Now, I must point out that it is important to have the nutrition to be able to have the ability to transform or make that conversion. And, you can talk to a nutritionist about it, but ideally, tidbit is eat a lot of greens. Spinach, kale, all of those are going to help the production of nitric oxide. So I don't know if you guys have been hearing, but there's a lot of companies out there that now have nitric oxide supplements.
I have seen that term.
Because they know the importance of it. It is our vasodilator of the body as well. So it is increasing the dilation of our arteries, which is allowing for that blood flow, decreases blood pressure.
So there's supplements?
Yes, there are.
Okay, is that truly beneficial? Like, is that something that you would recommend? Or, obviously we want to learn how to breathe.
Right. I'm an advocate to using what we were born with, what we were given. We were and I haven't said this before, and I've been kind of practicing this in and out, guys. I'm surprised I have not said this before, but we were beautifully created. We are created to heal. We're created to repair. And by doing what we need to, giving our body what it needs, that inhalation through the nose and out the nose is what helps our body repair and heal and be ready, rejuvenate for the next day. Add that, then the sleep component and what it does for us. So I talk to all my patients about the importance of nasal breathing and what happens if we're not nasal breathing. If that happens early on, yes, it can change how our face grows, because a constant mouth open position now is allowing that jaw to grow down and forward instead of...
Gravity is powerful.
So we end up having that longer appearance of the face, narrow, because we're constantly with the mouth open. Tonsils get enlarged because we're mouth breathing. Tonsils are overworking to do what the nose and the adenoids should be doing in conjunction with the tonsils and the lungs. So the importance of nasal breathing is to filter the air as well, to warm and humidify, prepare it for the lungs to deliver it to the rest of the body. Think of all the pathogens that are floating around us, picking this stuff up. So I always encourage my patients nasal hygiene. How can I encourage nasal breathing? Well, I can't tell you to close your mouth and stop breathing through your mouth if you can't breathe through your nose. So I always introduce nasal hygiene. I like to encourage a xylitol saline spray to all my patients. Clear it out. May need to use some irrigation. I use Sinupulse. Some will use the neti pot. If we have anatomical restrictions, we can use nasal dilators.
Like a deviated septum kind of stuff?
Possibly even with a deviated septum. Some will have a collapse side as well, but there are dilators, there are nose strips, there are nose cones. And I'll tell you, I'll do a test right in my office. It's called the Cottle test, where I'll show my patients, breathe in through your nose. How much air do you feel coming in? Now breathe through your nose. How much do you feel a difference? Well, then this is going to help you.
Sure.
More oxygen, more delivery. If we suspend that or lessen that, that's where the body gets into fight or flight because it feels threatened. It So then, there's a whole cascade of events that can happen if we don't give the body what it needs. And then we get anxious or we have panic attacks, and that could lead to other things as well.
Goodness. Are you guys hearing this ricochet? Like, go back and start this over and listen to the last 5 minutes because you just covered so many things.
Yeah. You talk about anxious, like people, they're dealing with all these common issues. I mean, allergies and inflammation too. Does that have to do with like poor nasal breathing too? Could be, yeah.
Could be a cause of it, or could be what's causing it. One of the, is it the chicken and the egg, as it was stated before? Right. Well, if we do have allergens in the environment, why do we have those? Is it not working? So if we're not putting the nose to work, well, now it doesn't have its anti-inflammatory mechanism, so now it's just getting worse. It's not getting better. Yeah. So what can we do? I always talk about steps with my patients, and besides the nasal hygiene, you want filtration in your room, the room that you sleep in, of course, to assure that it's the best breathing overnight, but you can have it everywhere. So as in the office, I have UV filtration as well as HEPA filtration, and then I have the filtration in each operatory.
So is this like air purifiers?
Air purification,
okay.
Correct.
Okay.
So inflammation can be a huge problem that limits our nasal breathing capacity. Allergens could be environmental, or they could be dietary. Environmental, unfortunately, our furry friends, we could be allergic to them. Dust, pollen, mold, and I hear from a lot of people moving into homes where they have existing carpets and nicotine, smoke, and things that were there before that they don't think it's there anymore, but the body senses that. Inflammation, dietary inflammation. I'll tell you personally, for me, I had my daughter tested for dietary allergies or sensitivities. So they're not necessarily allergies.
Sure.
Sensitivities will make you inflammatory to the body. That's anywhere in the body, including the nasal passages.
Oh, yeah, that makes sense.
And me personally, I put myself through it as well because I didn't want my daughter to go through it by herself. And I was already dairy-free, per se. I was drinking almond milk and would eat a lot of almonds. And my test came back as a sensitivity to almond milk.
No kidding.
And almonds.
Geez,
and eggs. And pineapple and cherries.
Oh no! I would be so sad. I should do that. Oh my gosh!
But things that I didn't think, because they're healthy,
right?
They're good,
right?
But at that time, my body was sensing inflammation or getting inflammatory responses from those foods. I did the 3-month cleanse. I reintroduced some of those foods, but I'm still kind of mindful. I don't eat almonds like I used to.
Oh.
They were my favorite pastimes.
That is the thing. You think that you're doing the right thing, but if your body isn't responding well,
correct,
it's just not going to work.
Correct. So what you think, and even within the same family, so her and I had pretty similar, but still different sensitivities. And I'm sure that if I put my husband through it, that he would have different sensitivities as well.
I think the one thing you said about that, though, is like if you're inflamed because of a dietary issue, that includes your nasal passages.
Inflammation in the nasal passages.
And that can hinder your breathing, which can cascade into other things.
Yes.
Yeah. Connections.
Can you walk us through, and I think you briefly did in a prior episode, but since we're talking about it here, if someone kind of wants to test themselves, if they're sitting here quietly resting or driving or something like that, walk us through where should your tongue be? How should you be breathing? How long should you be able to breathe through your nose before you identify this is an issue? Like, should you be able to do it for hours? So walk us through this.
So yes, a physiological rest position when you are sitting and listening is lips sealed, teeth apart, tongue up to the roof of your mouth, quietly breathing through your nose. So if there's noise while your lips are sealed, there's some resistance in there somewhere, and both sides aren't the same. And I will tell you, it is important to breathe through both sides of the nose, as I saw a documentary of a neurologist putting sensors on the skull and on the brain to see stimulation of the brain. When you block the right side of the nose, you lessen right side brain stimulation. If you block the left side of the nose, you do the same thing.
Oh, interesting.
And according to Patrick McKean, though, it is normal to fluctuate between right and left side. But imagine if you are deviated, congested, and you constantly have the one side block.
Yeah.
And I want to say that even James Nestor in his book, Breath, he had one of his studies that he wrote in there was about a schizophrenic.
He did, yes.
To start breathing through your nose and how some of her symptoms decreased.
Yeah. Yeah, you can't make this stuff up.
No, you can't.
No.
No, you can't. So when I talk to my patients about looking at themselves, someone had once asked, how often is it okay to breathe through your mouth? And a colleague instructor had said, as long as it's okay for you to eat through your nose.
Okay.
It really is never okay.
Yeah.
But I will say, if you are excessively doing some good workout, strenuous workout, you're really pushing yourself, then we need to eliminate some excess CO2 then.
Yeah.
That's when it's okay to breathe out through
I was actually just watching a YouTube video and you're talking about nasal breathing and how we should be training, even if you're like a runner or whatever, you should be able to still breathe through your nose. And I still when I'm running or whatever, I do try to do that, but then eventually it kind of catches up. Mm-hmm. So I've learned Lamaze breathing sometimes really helps, like that. And then I can start to breathe through my nose again, but it takes some practice. But your nasal passage, just what I said, is they are able to expand and you have to train them.
Yes.
And that's what we're talking about here.
So really focus on having that exhale through the nose as well. Mm-hmm. That's what oxygen advantage is. So I'm actually listening to that.
Like an audiobook?
Audiobook, thank you. So I'm actually reading through it for performance and endurance. So the breathing training that could be achieved. So Patrick McKean has a Buteco breathing app just to help improve overall nasal breathing. Inhale, we'll say 5 counts. Exhale, 7. Practice doing that. And then he'll change it up. Now do a longer inhale and longer exhale. And a lot of this he does then to kind of have a little bit of a bedtime routine, get the body in a parasympathetic state, more vagal tone, relaxation, help you go to sleep, already having that breathing. He also has a breathing app for kids. So if we have troubles for our kiddos, there is an app for children to do some exercise. So I will tell you, every day, there isn't a day that I don't do a nose unblocking technique. And he has a YouTube video on the nose unblocking technique. So if you ever feel like you're congested or one side isn't breathing, I mean, you can feel when there's resistance. Right. Do your nose unblocking technique to detoxify, open that up. And I have patients do that in front of me as well, and I'll do it with them and make sure your mouth is closed. Inhale through your nose, exhale through your nose. Have all the air out, keep your lips sealed. Now pinch your nose. Now you can either walk or you can move your head around, especially if you feel some sinus congestion. Mm-hmm. When you're ready, when you feel like you need your next breath of air, breathe in through your nose.
I imagine that some people feel very uncomfortable with this.
They can feel uncomfortable with it.
If they're not.
If you are anxious or feel like you can have anxiety or have a panic attack, don't do it.
Well, yeah.
Take your time practicing doing it, sitting down, don't walk around, don't move your head, just sit there. Take it slow depending on the individual. But his book with Oxygen Advantage then goes beyond in performance, strength training, endurance. So he has gone through, and I will tell you, I know of teams locally around here that do a lot with their breathing who outperform their competitors because they have higher endurance, recover faster because they're better nasal breathers. And they have been doing some of the different nasal breathing exercises. And the way he correlates it, we'll talk about the oxygen delivered, the increase in CO2, more red blood cells. He compares that to the Lance Armstrong, where they were doing blood doping.
Oh, right.
Where they would extract the blood and then extract the red blood cells from their own blood and infuse them back in themselves to have more oxygen carrying capabilities. We can do that by ourselves by just training our own nasal breathing to do that for us. Because what is it doing? It's creating more CO2 to be carried to all systems of the body. And as long as we're in a parasympathetic state, all organs will receive it. When we're in a state of fight or flight, the organs that are not necessary, and I want to say it's mentioned, the digestive, urinary, and reproductive systems get depleted. The ones that need it, heart, brain, lungs,
right,
and maybe some other ones, but everybody's different.
Wow. Okay, I know what I'm going to be doing this afternoon is doing all that.
I just find it so interesting listening to you because we've taken this episode itself from the basics of breathe better to live better, right? Like breathe through your nose to live better for your health, for your brain health. Do this. But now you've taken it all the way to the other end of the spectrum where it's like, not only can it help you live better, but it can help you
perform better.
Yes, perform better in multiple arenas.
Yeah.
So those of you with athletes in your lives, make sure you're sharing this with them too.
Again, we talk about this is breathing. So it's just like, when you dive into this, it's just fascinating. It's one of those things where I just am like blown away every time I learn more and more about it. But it's one of those things where you really just listen and try and just see how it changes your life, because there's so many aspects that can change for you.
Absolutely. And you ask, why do you get into this? Just as you are flabbergasted.
Get flabbergasted.
I was flabbergasted as well. And it's just like, I want to know more. I want to do more. I want to, how can I help?
And this is free. Like this is a free way. It's for people to improve their health.
Yep, absolutely. So I do a nose unblocking technique. I even did it with the kiddo. And when I do it with my kiddos, they think I know magic, but it's not magic. It's your body, baby. But, I say, I don't have a prescription to give you. Right. I just gave you this information. It's free.
Right.
It's all around us.
Well, and as parents, we obviously all want the best for our kids. So if we can help them instill these as habits when they're young, they don't even, we can educate them as well, and we should educate them as well. But these habits will be built they'll just carry them into adulthood without even having to think about it and having to build them at that time.
That's so beautiful. Yeah.
And I think about how many issues that kids can deal with that can be an indicator of nose breathing. And one of the ones you were talking about is how we're a filter, and how this time of year in the winter, kids are sick all the time. And I will admit, since I've been learning about this stuff from you, since you are our dentist and you've recommended these books and we've read a lot of them, I do think about this stuff. So if we're heading into a big crowd, I'm like, kids, breathe through your nose. Make sure you're breathing through your nose, because we're going to be filtering all the germs we're about to walk into a lot better than if they're sitting there breathing through their mouth. As well as with kids, if you have a nose picker, little kiddo that eats their boogers, all the kids go through this. It's like they're literally eating the things that your nose just stopped from going into your body. And so, I don't know, just educating, and it's just so interesting. So cool.
Well, I think one of the things you guys wanted to touch on is how can parents help their babies early on. And I will say, when I see my babies early on, to talk about the implementation of nasal breathing. So we will talk to our parents about, look at your baby when they're sleeping. Okay. When they're awake, it's a different story. You're goo-goo gagging and you just want them to babble. So you're not going to worry about tongue placement or lip seal because you're having fun with your baby. But when it's bedtime and your baby's sleeping more than you are, so you can check on that baby. If you see that baby's mouth open, look to see where the tongue is. It's okay if the mouth is open. Remember, the lower jaw has not developed up to the maxilla until about age 2. So that jaw is going to drop. The baby's relaxed. They're sleeping. All muscles relax while we sleep. Where's the tongue? If the tongue is down, gently go right behind that little jawbone, right to the soft part of that. Lift their lower jaw to help encourage that tongue reach that roof of the mouth. Hold it there, and then let it rest and relax. Some will keep their mouth closed. Some will open their mouth again. But where's the tongue?
Okay.
And I've showed my moms, showed my parents, tongue stays up. Tongue will stay up.
And that helps train them too.
Encourage it early on. Absolutely. But make sure they can breathe through their nose.
Yeah.
Okay?
Yeah.
So nasal hygiene, even in babies, is important. At 4 months, and it may be sooner than that, but at 4 months, that xylitol saline can already be used in our babies.
So just this quick squirt.
It's a mist. It's a mist.
Okay.
Not a spray.
Okay.
It's a mist. And something quick and simple to already get them acclimated to not have that battle when they're 6, 7, 8, 9, 10 years old. Okay.
Yeah.
To get them acclimated to having their nose clear and breathing through their nose. Yeah. No, that's pretty good stuff.
Yeah. And that's an easy thing that you can do for babies
Easily.
as well.
Absolutely.
What about, I know obviously like nutrition wise, chewing your food well, does that have anything to do with all of this too?
Early on.
Yeah, early on. And
well, yeah, even at, when we start introducing it, I know there's, debate, do they start at 4? Do they start at 6 months? When do I start introducing foods to my baby? So anytime that they can start those chewing muscle activities, anytime we're contracting those muscles, as you ladies know, we're working them, right? We're we're developing them. So as soon as we can even implement something, so we talked about the mild munchie in our previous episode, that in and of itself is already helping them work those muscles to grow and develop their face and their airway space.
Yeah, absolutely. Okay.
This is such an interesting conversation.
Yeah.
I'm so happy that you joined us on here because I think you're really going to help a lot of families.
Well, I hope so.
Yeah. We have one more episode coming up. We hope you guys will stay tuned for that one because you're going to continue to learn a lot more. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.